Good evening, everyone, and thank you so much for tuning in to today's webinar. My name is Annika Agarwal. I'm 16 years old and currently studying in grade 10 at Cheltenham Ladies College in the UK. I was diagnosed with celiac disease when I was 8 years old, and as a result of this, I founded Gluten-Free Geo, a social platform that is dedicated to providing access and information regarding celiac disease and living a gluten-free lifestyle in India. Please keep in mind, this webinar is being recorded. The link to the recording will be shared shortly after the webinar. I request all attendees to keep their mic muted during the session, and there will be a Q&A at the end, so please type in any questions that you have, and we shall take them at the end of the session as time permits. We will start off with introductions, a bit about Gluten-Free Geo, insights by Dr. Swati Agarwal, a Q&A, and resources provided by Gluten-Free Geo at the end. So today we are lucky enough to have with us Dr. Swati Agarwal, who has an MD in Dermatology, is a gold medalist, and is a director and consultant at Skination in Delhi. She has also previously been a research fellow at the prestigious AIMS in Delhi. As I mentioned earlier, Gluten-Free Geo is a social project that seeks to increase access and awareness on information on celiac disease and living gluten-free lifestyle in India. Our mission is to create awareness by conducting information sessions in collaborations with schools, and to promote testing and diagnosis for families from diverse backgrounds in partnership with local diagnostic facilities, and to provide resources, tips, and materials to help celiacs lead a healthy gluten-free lifestyle. We have conducted workshops at over 12 schools and virtually connected 100 schools across Punjab and Chandigarh to increase awareness. We have reached out to over 1,000 students. The Mayor of Chandigarh has also attended our session and recognized Gluten-Free Geo for its work in 2019. And also Ms. Gurbaksh Rawat, the Councillor and ex-Deputy Mayor of Chandigarh, applauded our work done during the pandemic last year in 2020. We've also developed free educational resources, including a children's book, blog, and educational videos to promote awareness and access to information on celiac disease. And the Gluten-Free Geo community on Facebook now has over 14,000 followers. We've also developed an app to increase access to gluten-free resources, such as restaurants serving gluten-free food and grocery stores carrying gluten-free supplies. And now on to today's topic, how gluten sensitivity can impact your skin. Thank you so much, Dr. Swati, for being here with us today.
Thank you, Annika. It's a pleasure to be on this platform.
So I'd like to begin by asking you, what is gluten and how can it affect a person with celiac disease?
So Annika, see, gluten is a protein, as we all know, which is most importantly found in some grains like wheat, rye, and barley. And so what happens is some people are inherently sensitive to that part, that protein of those grains. And specifically talking about people who have celiac disease. So what happens is when they keep taking that diet that has this protein, that is gluten, starts to damage their intestinal mucosa. So that's the basic pathology. So what do we mean by that? Intestine decides that how the food is absorbed. Actually, intestines absorb what we eat. It has those villi and those surface areas through which food is absorbed. So when a person is sensitive, those villi start to atrophy in the sense that they start to lose their function because of the antibodies that are produced. And therefore, there is an overall, that is the celiac disease, right, where intestine gets to atrophy and therefore there are malabsorption symptoms and malabsorption of nutrition.
So what makes celiac disease so hard to diagnose? Because there's over 300 symptoms, but from what I know, it's really hard to catch on to those symptoms and diagnose someone.
So see, Annika, I think, see, the reason is that your question has the answer. It's so difficult to diagnose because the symptoms are so varied. It's never always diarrhea. It's never always malabsorption. It's not flatulence. It's not steatorrhea. It can be varied. For example, in kids, it can just be a failure to thrive. They are not gaining weight. They are not, they are not having their right, basically, milestones and growth parameters. In adults also, they can be very varied. People just have anemia, just have, weak bones, and that's why it's so difficult, because you don't know which point is actually pointing towards celiac and when to test that. So that's the major challenge.
Right. So can celiac disease, because obviously, as I mentioned earlier, there's over 300 symptoms. So in that, like the subdivision that comes with skin symptoms. So can it be diagnosed from skin symptoms? And then as a dermatologist in particular, are there any really common skin symptoms that you look for that might indicate celiac disease?
Yes. So there is one particular skin disease, if we talk of actual specific symptoms, that is dermatitis herpetiformis. So what happens is people come with very itchy lesions. It's quite itchy skin condition in which there are small fluid-filled lesions on the extensors. By extensors, we mean on elbows, on knees, on the upper shoulder girdle and the buttocks. So they are very small fluid-filled lesions and they are quite itchy, and we call it dermatitis herpetiformis, and they are clinically diagnosed, and sometimes we take a small tissue biopsy to confirm the diagnosis. So this is one particular skin disease that when diagnosed as dermatitis herpetiformis is a direct correlation of celiac disease. So people with dermatitis herpetiformis again may not have intestinal symptoms, but they have gluten sensitive.
Right. So what is the mechanism by which gluten inflames our skin once it's been digested?
So basically, see the antibodies that we talk about. So there are tissue transglutaminase, there is epidermal transglutaminase. So it is considered that when the intestine is not able to absorb it, the intestine is leaky, and these antigens are actually penetrating the bloodstream and reaching the skin surface also. So there is actually the antigen antibody reaction not only at the the level of the intestine, but also at the level of skin when we talk of particular skin conditions like dermatitis herpetiformis.
Right.
So it's an antibody mediated inflammation of both the organs that's happening.
Right. So before I was diagnosed with celiac disease, one of my symptoms was extreme eczema on my arms.
Right.
So my question for you is someone with skin disease more, actually no, someone with celiac disease, are they more prone to getting skin diseases or issues related to the skin?
Oh yes, some studies suggest, Anika, that yes, people with celiac disease can be a little more prone to some skin conditions like dermatitis herpetiformis, and vice versa. Like people who have psoriasis, who have eczema, have been seen to improve when they go gluten free. So it's
Right.
not that every celiac patient is more prone to psoriasis or more prone to eczema. But yes, when they have eczema and psoriasis also in addition to their celiac disease, and when they quit gluten, the skin conditions also improve, telling us that yes, everything was a cascade.
Right.
So direct scientific correlation to pinpoint that yes, you have the gluten allergy and that's why you have the eczema. But no, the remission and the gluten-free diet shows that yes, it improves with that.
Right. So when one is diagnosed with celiac disease, should they think about changing their skincare routine? For example, a body moisturizer may have oats because it's like extremely moisturizing, but obviously oats has gluten in it. So can that have like a direct correlation to having a bad effect on your skin when you're suffering from celiac disease?
So see, talk of what we should use topically, being a patient of celiac, it's always according to guidelines good to avoid those constituents that are known to have those wheat extracts. For example, in food we say don't take wheat germ oil, so we say topically also avoid that. Also, honestly, there are not very good studies to say that if you apply on your skin that you will develop sensitivity and stuff like that.
Right.
Considering if we talk of what we should use, for example, if a patient needs more of moisturization, yes, because celiacs are many times also associated with hypothyroidism. So hypothyroid patient itself has a dry skin. So more like I would say it is more customized and more individual based depending on what all the patient is facing. For example, if many patients come, they have celiac and they have acne, they have eczema, or they have psoriasis. So honestly, it's more customized rather than a more umbrella approach for everybody. But yes, few changes, few considerations according to the concerns that they have definitely need to be made.
Like personally, the thing that I would recommend to anyone would be to change their lip balm and actually check the ingredients in their lip balm, because you're obviously applying it like 10 to 12 times on a day, you know, on your lips. So then you might
More
end
than
up ingesting
more
something.
than absolutely.
Yeah. So there's, it's like a fad of fashion for people to go on a gluten-free diet to, whether it's to get a healthy skin or just because it's the trend. So do you promote that, and what are your views on that? And do you think it actually is beneficial?
Anika, honestly, I would not. Considering, see, we should understand, yes, as you said, it's more of a fashion nowadays. Sometimes people might not be gluten sensitive, but they are on gluten free diet, considering that would help their body, immunity, and skin and stuff. Honestly, there are studies that say, and we know actually, that not all gluten free diet plans are healthy diet plans. We have to understand when we cut the gluten, we are cutting those fibers and whole grains also. So with gluten-free diet has to come a lot of mindful eating for your skin also, because moment you refine, you go towards rice, for example, from wheat, you are cutting a lot of things and you might not be mindful about that.
Right,
So gluten-free diet actually can be a nutrition deficient diet if not done
right.
mindfully. And already a patient, say for example, is celiac, so they're already nutrition deficient.
Mhm.
Switching to gluten-free again would need addition of nutrients. So honestly, I do not advocate or promote gluten-free diet for healthy skin as such
Right,
until you are diagnosed allergic to gluten.
right. So overall, how does the food that you're eating on a daily basis, how does it affect your skin? And like how much of a link and correlation is there between what you eat and the effect that it has on your skin?
Absolutely, a great correlation. You know what we are, what we eat. So as a dermatologist, I definitely have to say, even for under eye dark circles, for acne, for everything our patients ask, and we tell them you have to eat this and you have to avoid this.
Right,
For other various things in general. So definitely it has a direct correlation. Considering celiac, if we talk about, again, if you just go on gluten free, not adding the nutritions, you can also have the skin symptoms of deficiencies like vitamin B complex deficiencies, vitamin C deficiencies that can manifest in various ways on your skin also.
right.
So that's how it is definitely linked.
So earlier you mentioned that you shouldn't go on a gluten-free diet necessarily if you aren't actually allergic or suffering from celiac disease. But for someone who is suffering from celiac disease or gluten intolerance, because it can be like a nutrition like deficient diet, so you'll be missing, as you just mentioned, like essential vitamins such as vitamin A or B vitamins, magnesium. So what foods can someone who is suffering eat to kind of replace the lack of those specific nutrients in your diet?
Ideally, Anika, for a person who is newly diagnosed, ideally it's good to supplement initially with the right doses actually when it comes to iron and folic acid and B complex. But yes, over the course of time, because celiac is lifelong, it's best to add in the diet. So diet, for example, when we start talking of calcium, vitamin B, we start talking of dairy products. But many celiac would be lactose intolerant also, right? So that is when the supplementation of calcium and vitamin D has to be done, you have to take the medicine and stuff. But otherwise, if we talk of micronutrients, for example, if we talk of folic, iron, manganese, so various green leafy vegetables,
Right,
when we want to add vitamin A, D, so various, if people have non-veg, then various type of fishes, liver, red meat. So they start adding to the nutrition. So
right.
basically, understanding the wholesome requirement, it's good to take the help of a dietitian, especially in the beginning years of a newly diagnosed celiac disease patient, because it has a long way to go.
Mhm. That makes sense, yeah. So, nutrition deficiencies can also have an impact on the health of your skin, not only because of celiac or any other diet that you're on. So, besides what you're eating, is there any way that you can support your skin with nutrition deficiencies by using topical products?
Yeah, absolutely. See, like if there is a deficiency of vitamin B12, people just come with ulcers in mouth, or with vitamin C deficiency, they come with bleeding gums, or not healing properly, and different things. Vitamin A deficiency and dryness and all. So yes, topical regimes definitely have a good role to play. For example, with celiac and nutrition deficiency and dryness, it's always good to use thicker moisturizers to have more supple and soft skin, because topically also they start to enhance your overall skin appearance,
Right,
right? For otherwise deficiencies resulting in pigmentation on face. So it's always good to start using the sunscreens and the topical applications. So they also definitely help you. But yes,
right.
adding to the diet is the first step, especially in celiac.
Yeah. So our last question for today's discussion is, what is the connection between a healthy gut microbiome, which is obviously the thriving bacteria, and healthy skin?
All right. So yes, see, scientifically, if you talk about gut microbiome, has a great role to play, especially and when we come to celiac disease patients. See, their villi are atrophied. They are
Right.
not able to absorb the nutrition. We call it leaky gut. So it's leaking
Mm-hmm.
what we're eating. It's not taking it inside our body as nutrition. So when they are probiotics, when they are right microbes, they actually, I would say heal that mucus layer also. They prevent it from being leaky. So overall, it's helping in better absorption and treating in a way the malabsorption thing. And because celiac is it's this entire cascade of inflammation. So when you are stopping inflammation, when you are helping in absorption of right nutrients, it helps in overall decreasing that inflammatory cascade in body, and
Right.
therefore want to help skin also because that's no different from our body. So that's how it's definitely correlated.
Thank you so much for your insights, Dr. Swati. Now we'll move on to questions from the audience. We've got
Sure.
quite a few. Yeah, so this is kind of related to what we were talking about earlier. Someone has asked, can gluten be absorbed through the skin if you're using a sunscreen or a shampoo or basically any product that contains gluten?
So yes, there is lack of data to support that every part of it will be taken off, because otherwise also what you apply topically do not reach a lot inside your skin. There are penetration factors, and
Right,
they do not go very deep inside the skin. Therefore, more concentration, as Anika you were mentioning, is to the products that we apply on your face, on our lips,
right.
or oral cavity, the medicines, the lip balms and stuff.
Mm.
Although yes, being on the safer side considering celiac disease, we always have to keep a watch, and it's good to avoid.
Right. Yeah. Yeah. As we were mentioning, and as you mentioned now, I think just the top products that you might be prone to ingesting are the ones to be the most careful of.
Yes.
So someone has asked, they've been celiac for 12 years and they've started developing melasma on their cheeks. So does that have a relation to gluten and how could it be treated?
So see, melasma otherwise has to be treated with great efforts. It's a little, I would say, chronic and recurrent condition to treat, irrespective of whether you have celiac or you do not
Right.
have. So, treating of melasma sometimes can be a little challenging, considering, as I was telling you, it's recurrent, it's related to sun exposure, sometimes to hormones. So, the first step that I can tell for a melasma patient is strict sun protection, use of good sunscreens, right?
Right.
So, that works as the first step. There are various lightening things that we can do for melasma patients that come as topical preparations of that ideally should be done after consulting with a dermatologist. Those are glycolic acid, hydroquinone preparations. But yes, whether you have celiac or you do not have celiac, that needs treatment in a streamlined manner if we want to make it
Right.
better.
So someone has asked how to know if a product is gluten free. So I guess I could take that one as well. Like it's really important to read the label very carefully. And I think you would agree with that, Dr. Swati. Like there's some specific things to look out for, such as like it could say wheat product or barley, rye. Those are really common ones used, especially in Indian manufacturing. And it's also really important to just look out for the GF sign because it's more and more like common in India now. Whereas earlier, like 10 years ago when I was diagnosed, it wasn't there and you had to read through each individual ingredient. So what would your tips be on that, Dr. Swati?
Absolutely. I have to pick, even the minor ingredients, as you were rightly saying, wheat, rye, barley, everybody knows. More important is look for vinegar, look for malt, look for those ingredients that we know are taken off from
Yeah,
basic process that way. People sometimes ask me, oat is not that thing. Basically, we have to understand oat is also milled together with wheat, and
right.
change of cultivation results in, I would say, contamination. So we
Yeah,
have to, for ideally, I think that's the toughest job for a celiac disease patient to check the labels. But as you are rightly saying, we have to look for properly labeled gluten-free items. There are various brands that have been tested and notified and certified with gluten-free stuff. So that's the best way out.
yeah. Yeah, I think oats is one food that a lot of people actually have. There's a common misconception because oats is naturally gluten-free, but it's always, as you mentioned, milled, or it's grown in fields close to wheat. So it's always going to be contaminated.
Right.
And another thing to also keep in mind is like, so when I was younger, I really liked the dairy milk chocolate, and it's naturally gluten-free, but if you look at the packaging, it says made in a factory that processes tree nuts, wheat, peanuts,
Right.
so then you can't have it because if you're extremely
Right.
sensitive.
So very valid point, and all celiac patients, I'm sure they know, but they must know. It's not only that they do not contain gluten, they should ideally not be processed and not be packed also in the facilities that have gluten, because even the microcontamination can actually aggravate both the intestinal and the
Right.
if the symptoms.
And our last question for today from the audience is, can gluten like dry out your skin because of the connection between what we eat? And so yeah, can it dry out your skin is a question.
Sorry, can gluten?
Can gluten dry out your skin? Like, can I
Dry
have,
out.
yeah.
So as I'm saying, see, there can be various reasons why your skin dries out, because
Right,
gluten can be associated with hypothyroidism. It's a cause of dryness. Gluten can be associated with nutritional deficiencies,
right,
like various micro minerals and nutrition deficiencies. That can again be a cause of dryness. Also, eczema psoriasis patients, which I can say in general, you can say it's a dryness disease. Basically, you develop dermatitis. So yes, these things can be related. And if you are diagnosed celiac and you start taking gluten-free diet, there are reports and they definitely start to improve also.
right,
So use of right moisturizers, treatment in the right way of that disease per se, and following the gluten-free diet. So when we do both of these things together, definitely help a celiac disease patient with their skin concern also.
right. Lovely. Thank you so much, Dr. Swati, for your insights.
Pleasure.
And thank you. So thank you so much for taking time out of your busy schedule to speak with us. And thank you everyone for attending. I think we've all learned a tremendous amount about how our skin can be linked to celiac disease, or just in general, the effect of what you're eating on your skin. Whether you're a celiac yourself or you're helping a loved one who has celiac, it is important to note that there is a community of others who are in the same boat as you, and that there are various resources to help live your best gluten-free life. Please do check out the work that we are doing at my website at www.glutenfreegeo.com. Thank you, everyone, and stay safe.
Thank you.
Thank you, Dr. Swati.
Pleasure, Anika. Great initiative from your side. Pleasure to
Thank
be.
you. Thank you so much for your insights.
All right.